Dr. Ken Landau. Thanks for watching. Let's talk about Celebrex or celecoxib. It's a nonsteroidal anti-inflammatory drug, same family as ibuprofen and naproxen. Drug was patented 1953, FDA approved 1999. It went generic in 2014, which meant it became reasonably priced. It's still the 106th most frequently prescribed medicine in the United States, with more than 7 million prescriptions written every year. The indications for the drug are principally osteoarthritis, rheumatoid arthritis, and juvenile rheumatoid arthritis in children over age 2, also for ankylosing spondylitis, and sometimes it's used for acute pain or for primary dysmenorrhea, the pain around the time of the period. It's important to take the lowest dose for the shortest period of time consistent with achieving the goals because of the potential for side effects. Comes in capsules, 50 milligram, 100 milligram, 200 milligram, 400 milligram. You can take it with or without food. If you happen to have osteoarthritis, a standard dose would be 200 milligrams once a day or 100 milligrams twice a day. Juvenile rheumatoid arthritis, well, you take that on a weight basis. If you have rheumatoid arthritis, standard is either 100 or 200 milligrams twice a day. Ankylosing spondylitis, a little bit higher dose oftentimes necessary. If you have acute pain or if you have dysmenorrhea, then the dose would be 400 milligrams at one time initially, and then if you needed another 200 milligrams in the course of that first day, okay. And then on subsequent days, 200 milligrams twice a day would be the dose. Now, if you have postoperative pain, it seems that the Celebrex gives you about the same amount of relief as acetaminophen, which is Tylenol, or ibuprofen. And actually, there are still some studies that haven't been released by the manufacturers that were done by independent reviewers that seem to question the benefit of the drug. Now, interestingly, the drug just in May of 2020 received FDA approval in an oral solution to be used to treat migraine headache. Now, it's not the prevention, it's the treatment of migraine headache. And it seems to work a little bit. It was compared against the placebo, not against any active drug. Now, there's tentative evidence that Celebrex might help in certain psychiatric diseases. So people with major depressive disorder or bipolar disorder, and in small studies, schizophrenia. It seems like bipolar disorder is associated with neuroinflammation, and that neuroinflammation, inflammation inside the cerebral cavity, well, it might lead to depression. So people who were taking the Celebrex in combination with the Celexa did better than people who were taking just the Celexa by itself. The drug also has been used to decrease the incidence of either colon or rectal polyps. Question about whether it can decrease the incidence of colon cancer. That's unknown at the present time. Not everybody should take the drug, so if you happen to be allergic to the sulfonamides, not a drug for you because it is a sulfonamide. If you have hypersensitivity reaction to the Celebrex, don't take it. If you have a history of asthma, especially asthma that's worsened with aspirin, well, this isn't for you. And if you've had coronary bypass surgery, you have to be extraordinarily careful, especially during the first year after the bypass surgery, because you're at increased risk of heart attack and stroke. If your liver is moderately impaired, reduce the dose by 50%. If it's severely impaired, stay away from the drug. There's an enzyme that metabolizes the drug. It's known as 2C9. It's in the liver. And it seems that some people just don't have enough of that particular enzyme. And then they can't metabolize the drug very well. You get higher level, and then you can have more side effects. Well, the hint to that would be that if you've taken warfarin before and had problems with it, or if you've had problems with the metabolism of dilantin or phenytoin, stay away from the Celebrex. Now, Celebrex can interact with a variety of other medicines. There's a potential for increased bleeding, especially if you take it with warfarin or aspirin, or the selective serotonin reuptake inhibitors, drugs like Prozac or Paxil or Zoloft or Celexa, or if you take it with an SNRI, a drug like Cymbalta or Effexor or Pristiq. It seems that it's not recommended that you combine aspirin or any of the other nonsteroidals with the Celebrex. And certainly, if you happen to be taking an ACE inhibitor like an enalapril or lisinopril or an ARB, that's drug for high blood pressure like losartan or candesartan, well, that might lead to an increased incidence of complications, especially if you happen to be elderly or volume depleted or you have any kind of impairment of your kidney function. And you have to be careful taking the Celebrex if you're on a diuretic, thiazide diuretic, even taking Lasix might impair the ability of those drugs to get rid of the extra water. If you happen to be on digitalis preparations, digoxin increases the concentration and then can lead to some toxicity, so got to be careful. Basically the same thing with lithium. If you're taking lithium for bipolar disorder, well, it's going to increase the concentration of lithium in the system, increases the concentration or the toxicity of methotrexate and cyclosporin that you might be taking for kidney transplant. If you happen to be taking steroids, prednisone, maybe for some other kind of disease, increases the incidence of gastric ulcers, bleeding problems. And if you're taking a drug like fluconazole, it's going to increase the concentration of the Celebrex by about twofold. Now, women who are pregnant after the 30th week should not take this drug. There seems to be a connection between the aorta and the pulmonary artery in the unborn child, and that might close. It's called the ductus arteriosus. And if it closes, it's going to put an extra strain on the heart, and Celebrex is one of those drugs that might lead to the closure. Also, during the first and second trimester, there seems to be, at least in animal studies, some problems with holes in the heart between the left side and the right side of the heart, fused ribs. There's some problems with diaphragmatic hernia, increased incidence of stillbirth. So probably best to avoid during pregnancy, any stage in pregnancy. And as a matter of fact, in women who have difficult time conceiving, we know that the Celebrex is going to decrease the prostaglandins, and by doing so, it's going to decrease the rupture of the ovarian follicle and then release of an egg, so might cause some reversible infertility. Well, labor and delivery, it hasn't been studied, best avoided. Lactation, some is going to be present in the breast milk. Again, probably not appropriate. Elderly individuals going to increase the amount of the drug in the system just because your liver and your kidneys don't work nearly as well when you get to be 70 years old as they did when you were 20 or 30. So that's going to lead to a 40-50% increase in the concentration, especially prominent in women compared to men, probably due to the lower body mass index, lower body weight. So we know that especially in elderly individuals, especially when the systems don't work right, the intestines and the kidneys and the heart, we've got to be a little bit more cautious. Don't have to change the dose, just have to be more cautious. Now, there's a black box warning. The FDA says, hey, if you take this drug, you should know that you have an increased risk of having a heart attack or a stroke that can be fatal. And if you take the drug for a long period of time, the risk goes up. And if you happen to have coronary bypass surgery, you're going to have an increased risk of heart attack and stroke. And if you take the drug, you're going to have an increased potential for serious gastrointestinal toxicity, ulceration and bleeding and perforation of the intestines. Well, obviously, that's not good. And it can occur at any time during treatment, especially if you happen to be elderly, if you happen to have a history of gastrointestinal bleeding, if you have a history of peptic ulcer disease. Well, when you take the drug, about 1% of the people are going to have at least a threefold increase in their liver enzymes. That's a sign that there's some liver toxicity occurring. About 15% of the people going to have a less prominent elevation. So it's going to be less than threefold elevation. So it means that if you're taking the Celebrex and you happen to have nausea or fatigue, or you start to itch, or your skin turns yellowish, you have a flu-like symptom, all of those are potential signs of liver disease. Talk to your doctor about it. If you're taking medicines for high blood pressure, they might not work nearly as well. If you happen to have heart failure, might precipitate decompensation, might cause some edema. If you have an issue with your kidneys, have to be careful. The Celebrex can decrease the blood flow to the kidney, And that can be especially important if you happen to have heart failure or dehydration because of nausea or vomiting, or you're not drinking enough liquids, or you're taking those antihypertensive medicines we talked about, or you have liver dysfunction, or you're elderly. Obviously increases the risk. And then there's the problem with the asthma that we mentioned. It can increase your potassium, can lead to a serious skin rash that can actually be fatal. So if you happen to be starting the Celebrex, or you're on the Celebrex, and you develop a skin rash, you ought to stop and maybe ask your doctor if it's something that's important, because it can go on to an exfoliative dermatitis or Stevens-Johnson syndrome, toxic epidermal necrolysis. All of those things can be associated with death. And sometimes it can cause an anemia. So you have to monitor people who especially have had a history of anemia, because you can start losing blood from the intestine that either can be obvious with gross blood. That would be when the stool turns black, typically. Sometimes it has bright red blood. Or when the amount of blood loss is smaller, you can develop bleeding into the intestine, become anemic, and not even be aware that you're losing the blood. Well, it also tends to cause the fluid retention I mentioned a while ago. And the fluid retention just dilutes the amount of blood, so you can get a dilutional anemia. And then in addition, it seems that it might decrease the amount of erythropoietin. Erythropoietin is a chemical that the body manufactures that tells the bone marrow to make more red blood cells. Well, if you're taking the drug, it can cut down on fever and inflammation. That's what it's supposed to do. But then if you develop some other kind of a bacterial infection, now you don't have the fever, now you don't have the other symptoms that would suggest that you have an issue. So it can hide or delay the recognition of other kinds of diseases. Well, when you take the drug, it can cause the standard kind of side effects like abdominal pain and diarrhea, and sometimes indigestion or excess gas or peripheral edema. Your legs can swell, or you can become dizzy. We know that in the first 10 to 14 days after you've had bypass surgery, that taking Celebrex or any of the nonsteroidal anti-inflammatories can increase the risk of heart attack and stroke. So you should not take the drug in that acute post-operative time period. Now, the question is, how long does the period last? Well, even at 1 year after the bypass surgery, we find an increased incidence of all-cause mortality and reinfarctions and cardiovascular-related death. So it lasts a long time. By 4 years, well, it's still a little bit elevated, so still have to be careful. So we have cardiovascular issues, we have the gastrointestinal issues. And actually, they did a study, and they were looking at the ability of the drug to prevent adenomas, prevent the polyps in the intestine. And what they found was that there was about a 3-fold increase in the incidence of heart attack and stroke in the people. Now, interesting experiments were done in 2019. In February, they decided to look in the laboratory, not in humans, but in the laboratory, and use animal models of the aortic valve to see if they could prevent calcification of the aortic valve. One of the problems that we get as we get older, or if you have a problem with your aortic valve, is it becomes calcified, and then you get aortic stenosis, and they have to replace your valve. Well, it was found that actually, instead of preventing the calcification, maybe Celebrex increased the calcification of the valve. A study in May of that year, of 2019, looking at animal models and looking at a retrospective study of humans, they found that maybe there was about a 35% increase in the amount of aortic valve disease in people taking Celebrex compared to people taking the ibuprofen or the naproxen. Well, you do have to be careful of the gastrointestinal problems. We know that that's a significant problem, especially for older people, for people who have poor general health, people who have liver disease, but also if you're taking aspirin, or if you're taking steroids, or if you're taking the drugs for a longer period of time, you have a greater increased risk. Well, people say, hey, it's just a fancy kind of an aspirin, so that's not such a big deal. Well, if we look over the course of a year in the people who are taking the nonsteroidal anti-inflammatory drugs, 100,000 of them are going to be admitted to the hospital here in the United States every year because of toxicity from the nonsteroidal anti-inflammatory drugs, and it's estimated that about 17,000 of those individuals are going to die because of the nonsteroidal anti-inflammatory drug that they were taking. So you do have to have a purpose for the drug. It's not just one of those things, well, it's just an aspirin-like drug. I'm just going to take it for a little minor pain. Make sure you have appropriate indication for the drug. The way the drug works, it's analgesic, cuts down pain, anti-inflammatory, cuts down inflammation, antipyretic, brings the temperature back down to normal. Now, it's not a substitute for low-dose aspirin, so you can't assume that if you're taking the Celebrex, it's going to do the same thing as low-dose aspirin to prevent a heart attack. It doesn't do that at all. The way it works is Celebrex is a COX-2 inhibitor. Well, there are two different forms of the enzyme cyclooxygenase, abbreviated COX. We have the COX-1 that's very important, and the COX-1 is the housekeeping enzyme. So that protects the gastrointestinal mucosa, it protects kidney blood flow, it protects against blood clotting. So we don't want to mess with that. Well, when you talk about taking the ibuprofen and the naproxen, they tend to be non-specific COX inhibitors. They inhibit both COX-1 and COX-2. The Celebrex inhibits basically COX-2. That's the one that causes the inflammation. So that seems to be a relatively good idea. The pharmacokinetics, if you take the drug, well, you're going to find that at a dose of up to 200 milligrams twice a day, you're going to have a steadily increasing blood level, but after you get more than 400 milligrams a day, the level is not going to increase proportionately anymore. It's going to peak in the bloodstream after about 3 hours, going to reach a steady state after about 5 days. Food's going to delay the absorption by maybe 1 or 2 hours. So if you're taking the drug at a relatively standard dose, 200 milligrams twice a day, take it without regard to food. But if you're going to take it at a higher dose, say 400 milligrams twice a day, then going to have to take it with food. Much better because that increases the absorption somewhat. Well, if you take it with then antacid containing aluminum or magnesium, going to decrease the maximum concentration in the bloodstream by about a third. The half-life of the drug is going to be about 11 hours. That's why most people end up taking the pill twice a day. It's going to be bound to protein, about 97% of the drug. It's going to be metabolized by that 2C9 enzyme in the liver to 3 inactive metabolites. About 60% is going to go out in the feces, about 25% is going to go out in the urine. Discovered at GD Searle, that was a division of Monsanto, by Dr. John Tilley. But the interesting thing is that Dr. Simmons of BYU, he discovered the COX enzyme. So now they had an area where the Celebrex worked. He discovered that in 1988. 1991, BYU and Monsanto agreed to marketing or some sort of an agreement where the school would earn some money. Well, in 2006, BYU filed an action against Pfizer that bought Monsanto because they said they stopped paying us royalties. And after going back and forth in the courts, in 2012, Pfizer was told, hey, give BYU $450 million because you're not treating them fairly. Well, there's another drug that was very popular, and it was known as Vioxx. Vioxx also a COX-2 inhibitor, but they withdrew the Vioxx because it caused too many people to have cardiovascular problems. Then after that study that I mentioned that showed a 2.5 to a 3.5-fold increase in cardiovascular disease in the polyp study, then the company had a moratorium on the direct-to-consumer advertising for a while. That was in 2004. In 2006, they started again in the magazines, and the next year they started in the television. Now, Pfizer came out with comments on the drug that it was better in protecting the stomach from serious complications compared to other drugs in the nonsteroidal anti-inflammatory family. And that was a selling point. But federal investigators said, hey, that's the first 6 months of a 12-month study. We want some more information. And as a result of all of this, a federal judge unsealed thousands of pages of internal documents and deposition from the company in fraud cases. Now, talk about fraud. So one of the doctors who was instrumental in studying the drug, Dr. Scott Rubin, who was the former chief of acute pain at the Bay State Medical Center, that's in Springfield, Massachusetts, he produced 21 studies saying how great Celebrex was. But unfortunately, the data was fabricated. The analgesic effects of the drug were exaggerated. Now, here's the problem. He was a paid spokesperson for Pfizer saying how good the drug was. And Pfizer said, hey, we didn't know that he wasn't telling the truth. Now, unfortunately, none of the retracted studies have been presented to either the FDA or the European Medicines Association. And if we look at some of the other studies that suggest that there's either less heart-related problem, we find a really confusing story. So in 2013, a meta-analysis of hundreds of studies showed that there was a significant increase in the cardiovascular problems. That was compared to placebo. 2016, they did another study and they said, no, actually, it's just the same as naproxen or ibuprofen. And in 2018, an advisory committee to the FDA, well, they looked at it and they said, well, we really don't find an increased risk of stroke and heart attack compared to the ibuprofen and naproxen. So you can see that there's a lot of contradictory information. But do remember the adenoma study that we talked about? One of the adenoma, there are actually two adenoma studies. One of them showed no significant increase. The other showed an increase in heart attacks and stroke and cardiovascular-related death by somewhere between 2.5 and 3.5 fold. So what's the bottom line? The bottom line is that there's a lot of contradictory information, and that's why you take the dose for the medicine for the shortest period of time and at the lowest possible dose. You could overdose on the drug. If you overdose on the drug, you're going to suffer from lethargy and drowsiness, nausea, vomiting, maybe some pain in your belly area, maybe some gastrointestinal bleeding, and rarely some hypertension or acute renal failure. Some people have respiratory depression and coma. If they're found within 4 hours, then we can force vomiting. We can give people some activated charcoal. Fortunately, the drug's not mutagenic. It's not carcinogenic. Seems to perhaps increase the number of spermatocysts in animals. And here's testimony to the craziness in American medicine. There's a drug that's now available. It was available beginning in May of 2020, and it's called Contraindications. And Contraindications combines in one pill celecoxib and amlodipine. Now, those two drugs can be purchased for about $35 a month. But if you take the Contraindications pill, and if you take that, the price is $1,200 a month. So $35 a month versus $1,200 a month. But the drug company says, hey, we'll give you a copay coupon, so if you buy the $1,200 pill, you won't have to pay any copay. So some people do that. And that's ridiculous when you could go get the medicine for $35. Now, according to Consumer Report, there's no evidence that any of the nonsteroidal anti-inflammatories are demonstrably better than any of the others. For osteoarthritis, actually, there's relatively little evidence that a dose of 200 milligrams twice a day is any better than 100 milligrams twice a day. And they're about the same as naproxen at 500 milligrams twice a day. And for rheumatoid arthritis, 100 milligrams twice a day, 200 milligrams twice a day seem to have, for the most part, the same effect. And again, same as naproxen at a dose of 500 milligrams twice a day. What's the price? Well, if you get the 200 milligram and you get 60 of them, if you go to Costco and you pay cash, it could be as low as $39, some of the other pharmacies up to $430. If you have a coupon that you could get from GoodRx, price could be $9 to $12, except if you go to CVS, it's $106, or if you go to Walgreens, it's $118. Those two companies tend to be very high as far as the prices are concerned. If you want the brand name drug, you want the Celebrex instead of the celecoxib, well, then the price is going to be, if you pay cash, somewhere between $870 and well over $1,000 for a month's supply. If you have a coupon, it's still going to be about $745. And then we talked about the consensi, which is ridiculous. So that's the story about Celebrex and celecoxib. Principal reasons to take it: rheumatoid arthritis, osteoarthritis, ankylosing spondylitis, juvenile rheumatoid arthritis. But some people take it for pain, either acute pain or primary dysmenorrhea. Question is it better than ibuprofen or naproxen or even aspirin? And the answer is they all seem to be basically about the same. Now, some people are going to have a tendency to do better with one pill versus another. But overall, when we look at large numbers of people, there isn't really any benefit that we can see. Now, when we look at the incidence of stomach problems, these pills do pose a risk. There's evidence that Celebrex may increase the risk, especially if you have a history of peptic ulcer disease, if you're elderly, if you're in poor health, if you've had gastrointestinal bleeding before, history of coronary bypass surgery, avoid. Can they lead to an increased incidence of heart attack and stroke? Probably yes. After all, remember, they took Vioxx off the market. Took it off the market specifically because it seemed to be associated with heart disease. Celebrex, less so. But remember, there's a chance with all of the nonsteroidal anti-inflammatory. So that means the advice stays the same. Take the lowest dose for the shortest period of time and then get off the drugs if you can. Anyway, thanks for watching. If you enjoyed the show, please tell a friend. Consider subscribing so you'll be notified as we post new videos. I appreciate your interest. I'm Dr. Ken Landau.